What's happening, guys? This video is going to be the explanation on how to cope and alleviate some of the pains associated with flat feet. So let's get into it. Can you come closer? So, like I said, the medial gastroc is going to be underactive. So this muscles need to be activated. And this is how I do it. So you can either grab your knuckle, or I have this cane. Bring your foot up, and you literally just press on your medial gastroc. Come closer. Medial gastroc is right here, and you just press on it. After some time, your gastroc is probably gonna get really sore, and that's a good thing. That means your body is getting used, is understanding that it's there and that it could be activated. So you press on that. You make sure you stretch this side of your gastroc, right outside here. Stand up, and as you're gonna do some calf raises, I'm gonna show you calf raises. And you're finally gonna feel as if these muscles, the medial gastrocs, are gonna be active. All right. Before, when I used to do calf raises, I only felt my lateral gastrocs active, so I knew there was some sort of imbalance within my structure. So now that I've been doing the body cane and pressing on my knuckle, I've been feeling more of my medial gastrocs activated. So now I know I'm getting more balance between my lateral and my medial gastrocs. So another thing you guys can do is, especially you guys who have plantar fasciitis, get a ball, right? Step on it, and you just literally just roll all over it, all right? Especially in the middle of your arch. Just roll all over it. Where the big toe is, all over it. All right, guys, so you just pretty much just roll all over it, get off. Second thing you wanna do, look at me, is you wanna open your toes. Usually when you have flat feet, you tend to crunch it up when you walk. You tend to just grab the ground this way. So you wanna open up your toes, so use your fingers, spread your feet out wide, push it out. Let your toes extend or reach out as far as they can. Another thing you guys have to do is foam. This is the foam roller, right? You're gonna go on the ground, and you're gonna roll out the lateral side of your gastrocs. Some of you might feel pain doing this, but you get used to it after some time. When you find that spot that just hurts so much, stay there and relax over it. Feel it until it subsides. All right? Roll it out. Now you're gonna go on your adductors, so the muscles that cause your femur to internally rotate must be formal or stretched out. And roll this one out. And lastly, you're gonna go on your TFL. Usually I like to use a ball, but in the beginning you guys can use a foam roller. Press on it, rest right here, calm down into it. Now you also can roll on your low back if you're getting some back pain. So just roll right here and everything should feel a bit better after some time. But it's something you guys gotta do almost every day. It can be once a day, twice a day, but it has to be you have to be very consistent, persistent in terms of coping with the symptoms of flat feet. All right, last but not least is your soleus and your peroneals. You're gonna stand on the wall. You stretch out your calf first. As you bend the back knee, you concentrate more on the peroneals and the soleus. So you maintain the stretch, keep it there. Hold that stretch for about 2 minutes, and the pain should subside in due time. There's another technique I'll show you guys in case most of the people that were born with it, like me, develop adhesions in your lateral gastrocs and in your soleus. So there's ways to put pressure on those muscles so they could break apart and open up, so you can allow blood flow to pass through them and to release the adhesions that are formed in them. So I'm gonna show you guys a technique right now. So guys, I'm gonna show you the last technique. I can't use it on myself, so usually you gotta have a partner to do this technique. But I'm gonna have my cousin right here, I'm gonna do it on her. So this bear with me. So usually if you have flat feet, you're gonna feel these muscles out here being overactive and tight, and you won't feel too much of a stress here when I do the maneuver, alright? So you grab anything, you can grab it, anything that's straight, like a barbell. You can grab a mop or a dustpan holder. Pick it up. Rest it on the person's foot. Whoops. And you're just gonna roll it out. You're gonna feel pain. Most likely you're gonna feel a lot of pain with this. She's already moaning. You just press at the spot where you feel it. Make sure you push the.
Why did you give me a stick or something?
She said I think a stick. So I just did a technique on my cousin and she couldn't take it no more. So guys, when you start off, don't use a barbell. Use a like I said, a mop holder.
That stick.
Or any other stick, not like a barbell. Rubber has some weight to it, so the barbell in itself might be enough pressure. But these are some techniques that you guys can utilize to help cope with flat feet and back pain. So I'm gonna see you guys later. Peace.